So addiction is complex, but we know dopamine's role in drug reinforcement, and therefore addiction is very well established in the scientific literature. And we know this over the last couple of decades of research that's been done. Addiction is now understood to be a brain disease, and dopamine is very much at the center of that. So the reward system of the brain is where dopamine is active. Our reward system is primitive and was developed to improve our likelihood of survival. And so that reward system is really driven by natural things like procreation and eating food. So for example, when we eat food, we have a rise in dopamine and we get a reward from it and we get some pleasure from that. And in doing that, our brain remembers that pleasure and wants us to repeat that activity. And so we do. When a person uses substances such as opioids, cocaine, nicotine, for example, they get a surge of dopamine that's far greater than what would be considered normal. And the behavior is repeated over time. And when that behavior is repeated over time, the brain really doesn't like that because it's completely hijacked and out of balance. And in an effort to downregulate the dopamine or get things back to a balanced state, these chronic changes occur in the brain, and there's an overall actually decrease in dopamine or decrease in the response of dopamine in an addictive brain. So for that individual to receive the same level of reward, they have to use more and more and more of the substance. And that's what we refer to as dependence on the substance and tolerance. And also, when they don't have the substance, they get sick. And that's what we refer to as a withdrawal syndrome. People who are using substances when they are at that point of their cycle in addiction are not using to get high anymore. They're using because they need to use to feel normal.